Did you know that cervical cancer is the fourth most common cancer in women globally, according to the WHO, with 90% of deaths and new cases mainly from low and middle-income countries? Hello guys, and welcome back to my YouTube channel. If you're new, please hit the subscribe button so we can get to our goal of 100 subscribers by the end of this month. Today we will be talking about cervical cancer. Cervical cancer is a cancer that develops in the cervix, the lower part of the uterus that connects to the vagina. It is caused by the human papillomavirus, HPV, a sexually transmitted infection. HPV is very common, but most people who are infected with it never develop cervical cancer. However, if HPV is not treated, it can cause changes in the cells of the cervix that can lead to cancer. Unfortunately, there are often no early warning signs of cervical cancer. However, some women may experience the following symptoms: abnormal vaginal bleeding, such as bleeding after sex, between periods, or after menopause; pain during sex; pelvic pain; watery, bloody, or foul-smelling vaginal discharge. If you experience any of these symptoms, it is important to see a doctor right away. In 2020, there were an estimated 604,000 new cases of cervical cancer and 342,000 deaths from cervical cancer worldwide. 90% of these new cases and deaths occurred in low and middle-income countries. There are currently over 100 known types of HPV, but not all of them cause health problems. The mortality rate from cervical cancer has declined significantly in recent decades due to the widespread use of Pap tests for screening. The PAP test is the best way to detect cervical cancer early. A Pap test is a simple, painless procedure that can be done by a doctor or nurse. During a PAP test, a small sample of cells is taken from the cervix and examined under a microscope. If abnormal cells are found, they can be treated before they become cancerous. The Centers for Disease Control and Prevention, CDC, recommends that all women get a PAP test every 3 years starting at age 21. Women who have had an abnormal Pap test or who are at high risk for cervical cancer may need to get Pap tests more often. The treatment for cervical cancer depends on the stage of the cancer. Early-stage cervical cancer can often be treated with surgery, radiation therapy, or a combination of the two. Later-stage cervical cancer may require chemotherapy or a combination of surgery, radiation therapy, and chemotherapy. New vaccines. There are currently 2 HPV vaccines available: Gardasil 9 and Cervarix. Gardasil 9 protects against 9 types of HPV, including the 2 types that cause most cases of cervical cancer. Cervarix protects against 2 types of HPV. Researchers are developing new vaccines that protect against more types of HPV. These vaccines could help to prevent a wider range of HPV-related cancers. New methods for early detection. PAP tests are the current gold standard for early detection of cervical cancer. However, PAP tests are not perfect. They can miss some cases of cervical cancer, and they can also lead to false positives. Researchers are developing new methods for early detection of cervical cancer, such as liquid-based cytology and HPV testing. Liquid-based cytology is a newer method of Pap testing that uses a liquid solution to collect cells from the cervix. This method is more sensitive than traditional Pap testing and can help to identify more cases of cervical cancer. HPV testing is a test that can detect the presence of HPV in the cervix. This test can be used to screen for cervical cancer, and it can also be used to monitor women who have had an abnormal PAP test. New treatments. The standard treatment for cervical cancer is surgery, radiation therapy, or a combination of the two. However, these treatments can have side effects, and they may not be effective for all cases of cervical cancer. Researchers are developing new treatments for cervical cancer, such as immunotherapy and targeted therapy. Immunotherapy is a type of treatment that uses the body's own immune system to fight cancer. Targeted therapy is a type of treatment that targets specific genes or proteins that are involved in cancer growth. These treatments are still in the early stages of development, but they have the potential to improve the survival rates for women with cervical cancer. The best way to prevent cervical cancer is to get regular Pap tests. There are also vaccines that can help protect against HPV. The HPV vaccine is recommended for girls and boys ages 11, 12. The vaccine can also be given to older people who have not been vaccinated.